Selvi ma'am, would you like to be a first presenter, ma'am, if you are convenient?
That's fine, sir, no problem. Whichever is fine, I mean. Sir, sorry, your audio was not clear.
It was breaking. Can you please check yourselves?
Pardon?
Dr. Babu, your audio was not clear. Could you please come again with what you said?
I want to ask, should we start that
Yeah, first
webinar?
convenient.
Should we start that webinar?
Yes,
Hello?
Badu sir, should we start? Sri? Sidvi ma'am.
Yes,
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 ma'am.
Savita,
Dr.
yes.
Savitra, I think now we can start the program. Yeah, we can start the program now.
Yes, Jayashree. You can start welcome.
Good evening to all the esteemed guests, Honorable Principal Madam, and to all the supporting staffs and participants. Today I am privileged to have the opportunity to welcome you all in the national webinar on COVID-19 Jan Andolan and appropriate behavior for children on behalf of Vidyasagar College of Education. Vidyasagar College of Education was established on 3rd March 2008 in Fasidawa block in Siliguri subdivision in Darjeeling district of West Bengal. It is run by Kabiguru Ravindranath Tagore. My voice is audible?
Yeah, audible. Continue.
Okay, ma'am. It is run by Fasidama Kabiguru Rabindranath Educational Society to spread the light of knowledge in the society by providing the quality teacher education and to reach the opportunity of higher education to doorstep of the youth of the rural border area. The college is recognized by NCTE and West Bengal Teachers Training, Educational Planning and Administration University. The institute has been widely appreciated by the inspecting authorities for the institutional infrastructural facilities and the innovative working of and enthusiastic performance of the management as well as the staff. Our college has earned a reputation by offering programs both regular and online distance learning mode in teaching education leading to the degrees B.Ed and M.A. Education of IGNU. We can proudly say that all our students, they get first class in the university exam. We have also proud to say that we organize so many faculty development programs, workshops, seminars, conferences in past as well as in during that lockdown period. This college is highly reputed college and it is recognized by all in international authorities as well as national authorities. Our very supportive management and highly qualified principal madam, teaching faculties who always come forth with their innovative ideas and are ready to absent themselves with the modern educational treasure. This is because of the teamwork that we have been successfully organized workshop, 15 national, international webinar in this lockdown period. That's about the college. Today we have guest there, patron, that is Major General Manoj K. Bindal, Executive Director NIDM, New Delhi. Then Professor Santosh Kumar, our guidance, he is head of the department GIDRR and CCDRR, NIDM, New Delhi. We have coordinator Dr. Balu I, CCDRR, Center NIDM, uh, as well as convener Dr. Savita Misra, Principal of Vidyasagar College of Education, and Dr. Kumar Raka, Program Officer, CCDRR Center, NIDM. Then we have speaker Dr. R. Selvi Kumari, Clinical Psychologist, and Dr. Suresh Kumar, Head of the Department of Psychology, the American College. Welcome you all, the teachers and speakers, honorable guests to the national webinar. Welcome you all, sir, ma'am. Thank you.
Thank you, Ms. Jayasree, for a warm welcome to all the participants as well as the guests. This is the webinar on COVID-19 appropriate behavior for children in the time of COVID-19 situation, and this being organized by CCDR Center, National Institute of Disaster Management, Ministry of Home Affairs, Government of India, in association with Vidyasagar College of Education. So once again, I welcome all the chief guests and the participants. The purpose behind of organizing this webinar is we all aware that now more than 7 months we are facing a problem of this COVID-19, and now this government of India is slowly reopening one by one to recover our economy, right? And though the children are not face of COVID-19, but of course many children are also being affected directly by infecting COVID-19, and the children are also being indirectly affected in terms of their health, education, and various other aspects. Okay, and if you see a recent data now, almost more than 83 lakh people have been infected in our country, and almost 90%, it's 75 lakh people have been recovered, and the death rate is only less than 1%. Right. So by considering the situation, we are reopening slowly the one by one activities, and many state government also being started reopening the schools and all other educational institutions. And at the same time, we are also going to face and celebrate a lot of festivals in the next month. So this is the situation where we need to protect our children from this infection of COVID-19, right? Considering this, our Honorable Prime Minister, Mr. Narendra Modi ji, has started a campaign called Jan Andolan to create awareness among all the people about this COVID-19 appropriate behavior. So in connection with this Jan Andolan campaign, we are organizing this webinar on Jan Andolan COVID-19 appropriate behavior with reference to our children, because children are always depending on the parents, and most children, whatever the activities which we are doing, we always take or we always carry the children with us, right? Even if you are going for buying your dresses or crackers, whatever may be, we are not ready to leave. We can't leave the children alone. So we are taking them into the even crowded place, which is not advisable, but many times we are not able to avoid it. So that's the reason, to protect the children, we need to create certain appropriate behavior among our children. It's our responsibility to learn the parents as well as children, right? So in this connection, we are organizing this webinar in association with these educational institutions, and especially this webinar is organized for the children as well as parents. Okay, with this my address now, I would like to invite Dr. Savita Misra, Principal, Vidyasagar College of Education, to deliver opening remarks, please. Please unmute, ma'am. Please unmute yourself. Yeah, you are unmuted. Please continue.
Yes, sir. Thank you, sir. Respected Major General Manoj K. Bendal, sir, Executive Director, NIDM, Professor Santosh Kumar, Head JIDRR and CCDRR NIDM, Dr. Kumar Raka, Program Officer, CCDRR Center, NIDM. The speakers of today's webinar, Dr. R. Senvi Kumari ma'am and Dr. Suresh Kumar sir, and coordinators, Mr. Jayasree Paul and Dr. Balu sir, and dear participants. Good evening, everyone. It's my pleasure to address this session as opening remarks. The topic, appropriate behavior for children in relation to COVID-19, is one of the most important issues in recent time. Everybody, right from laymen to topmost professionals, scientists, bureaucrats, politicians, all are talking about COVID-19. Everybody is equally concerned. But whenever we talk to someone after dysenteries, what we ask them about the cases. Case invariably mean cases of corona, whether it is increasing or decreasing. If we hear cases are decreasing, we have a sigh of relief. But reducing cases sometimes gives us false sense of assurance and confidence that corona is no more a serious issue. The thought that the cases are decreasing and the pandemic is dwindling is dangerous and cause of concern. This is because in real sense, the pandemic is still there. The so-called second wave of increasing case load in Western countries like US, Britain is testimony to such incidents. Therefore, it calls for caution. The COVID-19 pandemic has been described as the biggest challenge facing human kind. The pandemic and its fallout on health and economic systems across the world have precipitated an unprecedented humanitarian crisis. As the world navigates through the new normal of the pandemic, it is important for the humanitarian systems to recalibrate their priorities to serve the interests of the most vulnerable and at risk populations. Realizing all this, our Honorable Prime Minister has initiated 10-point agenda towards disaster risk reduction. The eighth agenda covers about appropriate behavior for children to stop the spread of COVID-19 among children. This is most relevant as we are contemplating to open the schools in the days to come. As we know, the children sometimes are not that serious as they should be. There was a circulation in social media that children went to school with one particular mask but came back with different colored masks. When intercepted by parents, they confessed that he changed it to someone as his mask was better and the other one changed it to someone else as he considered that other one's mask was better than this. This signifies that the children need to be taught the importance of wearing masks. The wearing of masks is not for fashion or show off, but a necessity to stop the spread of coronavirus. Thus, it is one of the appropriate behavior children need to be taught. Not only they should be asked to wear masks, but should be made aware that why should they wear masks and why they should not exchange masks with others. Similarly, there are other protocols such as maintaining safe distances of 6 feet, frequent washing of hands, coughing etiquettes, etc. I am sure all these and other protocols which are important for our safety would be discussed in detail by our experts, Dr. Sidvi ma'am and Dr. Suresh sir today. I request all the participants to hear them patiently and disseminate the knowledge of appropriate behavior to be participated by children to maximum people possible, so that we make it a Jan Andolan as envisaged by Honorable Prime Minister and contribute towards our fight against corona by up-scanning the appropriate behavior. We all should ensure that the mankind win the war against corona. This jeetega, corona harega. With this, without much ado, I conclude and request the experts to address the session. Thank you all. Yes, sir.
Yeah. Much for the brief introduction about the program and giving the importance of appropriate behavior for the children which we need to follow. And with this now, it's my privilege to invite Dr. Suresh Kumar, Head Department of Psychology, the American College, and he is assistant professor and also heading the UG Department of Psychology, American College, and he has also has the experience of working with various national level institutes and central universities, and he also has successfully completed more than 250 webinars in the field of mental health series of the children especially, and he is also making simple our work because we also work towards the safeguarding children, and Dr. Suresh Kumar, this mental health webinar series also focusing on the children's issues. So it's we are happy to join together with Dr. Suresh Kumar for organizing this webinar, and I can see that he is a well-known person at national level, and he also is the pioneer in doing this all courses or these webinars and all. So with this brief introduction about him, let me hand over the session to him. Dr. Suresh Kumar, please.
Thank you, Balu sir, for amazing introduction about me. Very good afternoon, one and all. And today I'm going to with you for another 40 minutes. Just I'm going to share my learnings and experiences. It is my, I can remember, it's my 10th presentation to NIDM. And whenever I got an opportunity, and every time I have to prepare a new content. So when you are having that opportunity, then only you will explore. And for expanding my knowledge, the more credit goes to NIDM. So I record these things, and I record sincere thanks to the coordinators, patron, Mr. Major General Manoj Kumar Pindal sir. And I met him in the first webinar session. I think he's a highly resourceful person. Thank you, sir, for organizing such a webinar series to promote awareness among the public and the parents and the stakeholders who are working for the children. And the co-patron, Dr. Professor Santosh Kumar, sir, is the head of the department of NIDM, New Delhi. He also delivered few sessions when we were arranged. He is a very excellent person, an eminent one person also. And today's convener, I think just now we heard a remark, introduction remark from that principal of Vidyasagar College of Education, Dr. Savita Mishra. Thank you, ma'am, for making us the program very smooth. I think the very beginning need, I think you have done that. I think we have to take over that. That's it. And the coordinator, the another convener, Kumar Raka, eminent person. And I had an opportunity to listen some of the sessions also. Highly experienced and highly knowledgeable person in the field of, and the dynamic person. Like co-speaker is Dr. Selvi ma'am. And when I was introduced by Dr. Balu, he told me that I'm conducting a webinar. And Dr. Selvi madam is on co-sponsor for the program. MHA Institute of Mental Health is on sponsor for that webinar session from the day one. And she's a very renowned clinical psychologist in Madurai. When you come and name her, and then Dr. CRS and Dr. Selvi is very known to all. And we were in the side of them only. Thank you, ma'am, for being as a speaker here. And the coordinators, I would like to say the dynamic person are Balu. I met him in one of the face-to-face training program at Tirunelveli MS University. There I can see for 10 days. I think if I was asked to take a session for 1 or 2 days, I will be tired. But he's the person I've never seen him tired. And if someone is not there, okay, I will take the session. So that's such an enthusiastic person. Even coordination also has done. And networking throughout the nation is very difficult task, but we made it. And I appreciate, sir. I can see your progress in the field. And another coordinator, Deepika Adhikari, for welcoming all of us. Thank you all. And all the participants, again, good afternoon to all. I would like to present my learnings regarding appropriate behavior for children. So I have to ask myself whether I'm the right person to answer the question. First, we must know what is behavior. I think the program was organized by College of Education. Okay. In the education, when you define that, what do you mean by education? We will go to that the father of the nation, Mahatma Gandhi. He said that all-round development of body, mind, and spirit. All-round holistic development is an education. And in layman perspective, if you ask any person who has done an education on B.Ed or M.Ed, and if you ask them what do you mean by education, they will say that modification of behavior. Okay, education means modification of behavior. And if you ask the person who work from that psychology or behavioral science, what do you mean by psychology? Study of behavior. It means overt behavior or covert behavior. They will study. Without studying behavior, is it possible to modify? So education has an important parcel of behavior. They will study psychology. So with the remark, I will begin my presentation. So I'm going to talk about the appropriate behavior for children. They can follow during this lockdown period. Just a minute, I opened it. Sir, can you able to see my screen, sir? Balu, sir.
Yes, visible. It's just opening.
Thank you, sir. Thank you. Yes, it is about me introduced very well. And when you look at that, any standard dictionaries or any reference book, you can find out that what is behavior. The way a person who, yes, sir.
Slides are not visible, but it's processing.
I think just a minute, sir. I think I shared another screen. I'll do again. Yeah, yes. I found it. Instead of sharing that presentation, I shared my screen. Thank you, sir, for the reminder. Now is it visible, sir? My slides?
Yes, it's visible.
Thank you. Thank you. So when you take any standard dictionaries or reference book, we can find out what is behavior. In general, if you ask me anything, you can observe externally. Okay, Rajnikant, the behavior you can say, the speed you can say, and when you name the person, and you can say that behavior by observing the way someone acts or behave in a particular situations, or the mannerism of an individual, we can call as a behavior. And what is appropriate behavior? It is very important. Anything you exhibit in an environment or in a place which is liked by most of the people in that place, we can call it as an appropriate behavior. For example, someone is, if the teacher is coming in the classroom, I'm saying about that nowadays these practices are not there, and the teacher is coming to the classroom, the greeting you can receive from the students is an appropriate behavior. So likewise, something the society expects something from that most of the people, if the person exhibiting that particular behavior, we can label that as an appropriate behavior. And now we are going to look at that the mass movement for COVID-19. It is one of the pledge taken by our Honorable Prime Minister Dr. Narendra Modi ji. And he said that appropriate behavior we have to cultivate, or we have to create awareness among the people. Okay, for that the Ministry of Family Welfare and they developed a pledge for that. Okay, here is the pledge. I think you can take it in the website itself. And they given that most important thing, the behavior is something we can exhibit which not spread the virus to somebody who is near to us. The same, what are the things we can do that? Wear mask properly, wash your hands frequently, and then maintain the social distance. These are the three major primary, I can say, major and primary behavior we have to follow. Now I'm going to tell you, there is a guideline given by the same ministry. What are the behavior we can cultivate among the children to ensure that appropriate behavior? Okay. So one is on greet without physical contact. Actually, these are our traditional practice. I can say that in when you look at any kind of Indian, when they meet somebody, now I can see predominantly these practices were followed in Thailand. But in India, when you meet somebody, when you want a greeting, vanakkam, namaste, these are the words we can say that. Okay, when we will not use to contact other person, because the climate condition will make us to behave in a way. Why we should not connect with other people physically? Why we should not contact other people physically? When you touch other people, there is a high possibility, like in our country, the tropical regions, the virus, the bacteria in their hands may be passed on to us. So that is the reason they had on practice, they have to greet in a distance way. So these are the traditional practice we can practice now for this COVID-19 period to protect ourselves. And another one is, I think there is another behavior we have to teach our children. Children are, whenever when you say something, don't close with the other persons who is, when you play with your friends. And they will listen them, for even if you give the direction and instruction to them for 5 minutes, they will listen them, okay. And it will be there for 10 to 15 minutes. And after that, what they will do, they will mingle with them. And they will not maintain the social distance, the physical distance between one another. And these things, when you have to be a role model to your children. You must be a role model. When you close to somebody else, and when you ask the children, don't do that, then they will not do that. Mostly, observation learning is very common among children. When you want to ensure this physical distance, to avoid physical contact with another person, this crisis time, you have to be a role model to your children. And the next one is, I think these are the things we can do with greeting. We can train the children. There are practices are there. Recently, I had an opportunity to witness that how the behavior were taught among the primary school kids, nursery and primary school kids. And some of the countries, I think they are saying that the quality of education is very good. What they are doing, they are cultivating or they are training the appropriate behavior among the children. There is no examination for them up to 7 years. Up to 7 years, from age 3 onward, they will be entered in the nursery schools. Okay, what we can call as kindergarten schools or Montessori schools. There, what they will do, they will train them how to behave. That's why Government of India also insisted that activity-based learning. When you want to train particular skill, you have to be a model to them. So activity-based learning ensured, and these are the behavior can be trained in the schools. I think that is an ideal place. Now we are not able to have the schools, and we have to teach these things in awareness videos, or the elder members in the family, they can teach them how to greet others without touching them. And this is another practice we can ensure. And when you look at that, some of the videos are images in shared by the different educationists and the social activists. They will say that some of the innovative or creative way you can maintain the distance. Here is the one 6 feet distance. You can one person who wear a stick, and another person who had an umbrella, and another person who wear in that balloon. There are many models you can use. Here is an ideal model. You can when you create an awareness among children, you can say them, this is the way you can maintain distance. When you go to the temple or when you go to the somewhere nearby places, you have to maintain, especially when you are going to the public places, you have to maintain physical distance. And most you can see the bus stand is a crowded place. Mostly when the bus station, when you're waiting for pick up the bus or vehicles, and most of the population in India, we have to admit that most of the population in India, they are not afford to travel by their own car, and they have to go for only public transport. When they wait, and I can see that they followed in the beginning days, but now I can see that many of them are not following social distance, and we have to understand that the harmfulness of COVID-19, and the second wave is emerging in different European countries, and then we have to be very careful. That's why this pledge was introduced by our Government of India, and this is a place we have to maintain social distance. And when you go to any hospital or any places, any functions, if you go there, and then the waiting places, you have to ensure that you have to give a space between one person to another person. This behavior you can become a role model to your kids. And another one is at school, and they will maintain this kind of circular. They will draw. It may be in a paint or it may be in a ring. They will put it, and then they will ask the children to maintain the distance. In the play area, okay, this area have to be there. Don't very close to other places. But these are the places you have to maintain social distance. The classroom arrangements, and the India-like country, I think we are not having that adequate infrastructure facility for providing physical distance. And I can remember that in most of the schools in villages and different parts of India, in a classroom, they will be there very close to nearby another person. That is the way they can sit to listen to the teachers. But we have to ensure these kind of things. I can say that the blended teaching method will help us to ensure that physical distance at classroom also. And when we come to know that a person is having the common cold, okay, the person is coughing, and you just stay away from the children. First, when you as a parent or as a friend, when you stay away from such a person, and they will ask you, why you away from that person, even that person is a relative or friend, why are you stay away from them? And then you have to tell them the person is infected. There is some possibility the virus may spread among the persons who are near to us. That's why I'm staying away. So you have to do that. And I think here is two kind of discussion is going on in social media as well as science researchers also. Some they are agree with that reusable masks are not suitable, and some of them are saying that yes, it is suitable, and N95, and there are dedicated masks. But I just referred one of an article which says that reusable masks prevent 90% of spread of the COVID-19. When you are not touching your nose, mouth, and then eyes, there is a high chances you will not get infected. So these reusable, why we have to use reusable masks? There is another question. We all know that a majority of the populations, they are not able to afford every day they have to buy a mask. So for them, this is an alternative way. We can teach them how to maintain. They can buy a 3 mask. In a person, they have to maintain a 3 masks. Reusable mask, they have to wash. Once they are using, the next day they have to wash, and then they have to dry that mask. Okay. So when we practice these things, and the children will learn, as I said, they will take role model from the parents. When you do that, and they will plan it. And here you can see that the children are very more fond of using that colored mask. Okay, if they found something colorful, they like it, and then you can buy less than 10 rupees also available. I found that, and some of the organizations are giving free of cost also, and you can get it, and then you can use it for covering your face. And how to wear a mask? I can see that they will wear a mask for their cheek and for the forehead, and some they put it here and somewhere at one side and another side. See, when you are not wear the mask properly, how we can expect the children will do that? And some people will do that, they will remove mask like this. And there is a way we have to use it. This is the way you have to wear a mask. And you cannot assume that we know how to wear a mask. No, even they don't know which the front side, which one is the back side. Many of the adult people, and how we can expect the children can understand that front and back side and how to wear it. And when you train the children, when you become a role model to your children, the first time you have to say that, okay, come here. So this is a mask. You have to tell them why you are wearing a mask and how to wear it. And what are the areas you should not touch. This information you have to give in it. It may not take not more than 2 minutes. You can teach this in the beginning itself, and by showing the pictures, it is an appropriate thing. And here you can see that when you are using the medical mask, especially those who are working in the clinic and who are supposed to work with more number of people in that community or in our place, they can use this, and they have to wash the hand and use that, hold the mask in that particular place. I think I kept the mask on that side. And so, and you have to use, you know, the which one front side and then back side, and then top, or you can just a clip will be there, which will not allow the air to go to your eyes and see here. This is the way you have to place it. This is an appropriate way we can wear a mask. And when you know that, you can teach these skills to your children. Knowledge is skills. And many of you having the knowledge. But when you ask someone to wear a mask, we can see that a lot of funny images you can find it in the social media, how they are wearing the mask. Some people wearing the back side. So these kind of things, it is there, even the adult people. So the children are more fun oriented, and then they are more dynamic in nature. They will be listened, and when you give the instruction to them, in a way they can able to listen. For that, you have to connect with them, and then you can correct their behavior. And where we have to use the mask. So when we travel and we go to the public places, we can use the mask. Or when you are waiting in the classrooms or in a room where we were visited for birthday party and some other family gathering, there you can definitely, you must insist all the family members to wear the mask. And if anybody in the family members or anyone in that crowded place, in public places, are sneezing, or you come to know that they are taking medicine, and you just wear the mask. Even if they are instructed or not, you just instructed, wear the mask. And another behavior, appropriate behavior, this COVID-19 is that we have to wash our hands properly. And there is a way. So how to wash the hands is on here. I think you all know that by seeing the picture itself, we can able to understand that. And here, once we are not having the soap, and if you have to meet many people and interact with other people, you can use hand sanitizers. So this also kills more germs and viruses, and avoid touching. Here you can see the kids will be more funny. They will be touch all the single common. They will touch eyes, nose, and then mouth. So teach them. Don't frequently. We have to tell them when you watch them. You have to frequently insist them. Don't do that. Reinforcement plays an important role. As you all know that in behavior theory, they insisted when you want to strengthen the particular behavior, insist, reinforce again and again. So that behavior will be strengthened. And why we should not touch our nose, eyes, and the mouth? When we touch the surface and anywhere, and if we are not aware about it, and there is high chances are there, germs and viruses may get through very easily. They very easily get through. That's why we are insisting them, don't touch a space and somewhere which is more prone to germs and viruses. And once it is uncontaminated, that for example, knowingly, unknowingly, if you touch something with your hand, there is a virus in your hand, and if it is transfer the virus to your eyes, nose, there is a high probability of it passing through your eyes, nose, and then mouth. And once if it is entered, it will enter to the body and you feel more illness. We can see that the first day will get an cold, common cold, and sneezing will be there, and fever we can see in an individual. And respiratory hygiene. Respiratory hygiene is something, and when we were there, I remember one of the behavior of a gentleman who came to purchase something for his home. He wore a mask until he reaching that place. Once after reaching that place, I think he got a sneezing. He removed the mask and then sneezing. The purpose of wearing mask is to avoid the contamination or spreading the virus to other people. For that purpose, we are wearing. But he came very close to the people who are standing over there. He is removing and sneezing. So it is because he thought that if we wear the mask and then sneeze, and then it is an uncomfortable thing, we have to inform them why we are wearing the mask. And when you are not having that, suppose you forget to take your mask, what are the things you can use your handkerchief or a cloth, or maybe anything, you can just cover your nose and then mouth, or you can use the elbow, which is common. And the elbow will cover most of the time. Yeah, having that anti mask. And once if you sneezed or when you are exposed to the public places, when you come to your home, you insist your children to wash their hands frequently. Okay. Even though if somebody is coughing or sneezing, when you come to the home, just ask them to wash their hands. And it is regularly you have to do that. I think before taking item, and when you before other people, you come back from the public places, and when you after play, every time when they come back, one of the good component thing is that we learn that how to maintain health and hygiene. So this COVID-19 teaches most of the people around the world to learn these health and hygiene practices, washing their hands. And I think some of the family, I can see that they will, especially for boys hostel and somewhere, they will clean the room once in a week. But now here we can, the regular cleaning and disinfection of spaces is very important, especially these places we have to identify which is more prone to that infection of viruses. We have to clean. And then when you look at that, most of the hospital, and they will clean the places every 3 hours. Why they are doing it? They know that germs are the root cause for the many we are facing, especially COVID-19 such a thing, and we have to de-infect that. So for that we have to clean properly. And I think some of the gentlemen, people who were very fond of spitting, I think some of the country now in India, they are spot fine, 1,000 rupees you have to pay when you spit in public places. And there is a high chances that there in open place when you spit, there is a high chances that someone is very close contact to that saliva, the person may be infected if you are infected with COVID-19. And every time when we who is spitting on the public place or in a place, very corner, they may say, no, I'm spitting in a far away. No, you are the person, you are making that particular area as an more, you are making other people's life is a more risk. So don't do that. And if you have done practice of that behavior, probably. And high chances are that when we do that in that public place. And the people are thinking that, no, I'm using the Dovaka product that I'm not a COVID-19 patient. So it will not affect, no, even if you are using that Dovaka product and there is a chance that it will be spread to your saliva. It's a movie, you all know that. I don't want to say the movie. Can anyone please name the movie? General knowledge question. In South Indian, we were not exposed to the North Indian movie, but this is very popular among even South India also. Can anyone please tell me the name of the movie? Okay, I think so. I think as per the government law, I think it is a punishable offense when you speak in a public places. And when we decided move on that, don't try to avoid that travel. If it is necessary, then you can go there. But it is unnecessary. I can see that there are still the government is announced that tourist places are not allowed. But I can see that in the name of 4 days, my house is there in that way. There are many people are traveling, and this is not a right time for travel. And we have to insist when The children may say that we will go there. No, you have to say them, this is not the right time. And don't discriminate. If someone is there and having that cough and cold and they come to know that, now I can say that there is a discrimination is there. Someone in the street who caught on COVID-19, they come to know that COVID-19 positive, and no one will be discussing. The earlier, now we are having that enough awareness, but in the beginning, earlier, when the COVID-19 was spread, and once they come to know that the person having that, all the people will discriminate. No one will, even they will not talk to them in a mobile phone. Such a way, discrimination will happen. If you come to know that, don't discriminate. And when you do that, the children also take it from you. And when the person who were fear about that, okay, I may be infected 19, compassionate, love them, unconditional support. Yeah, that is the time you need. There are studies were given that when you compassionate and somebody realizes that someone is there for us, and the immune system will be developed. If no one is there, and then the fear will be there, and then fear, cortisol will be there, and cortisol secretion will down your immunity system. Okay. And this is the time, as a adult person, responsible citizen, we have to thank that corona warriors, the frontline warriors, doctors, and other people. You have to thank them, respect whenever you see them. Okay. And when you do that, and then your children also take from you, and then they will practice it. Yes, care about others. That is care, compassionate. You as students, respect and then encourage. These are the four things you can practice and then teach your children also. And wherever it is possible, you can do that at this stage of crowd. And now I can see that for Diwali and Navaratri festival, for purchase, I can see there are huge crowd, and some of the shopping malls were closed by government, by force. They force them to close that because they are not maintaining that guideline given by the government. And they may thought that the fear about the COVID-19 now it comes down. It is because of the awareness created by the government and other NIDMs like organizations. They created more awareness. That's why the fears come down, anxieties come down. But it doesn't mean that less less infection may not cause it. There is still the percentage. 1 to 2% of people are highly infected. They are going to die. 2%. Just imagine that. 100% are infected means definitely 1 or 2% will die. We're going to be make you need to just surrender yourself for that. And there is a festival, there is a family function. Just avoid that function and say no to crowded places. Government given that many this kind of awareness complete in most of the places. Teach them avoid the crowded places. It will be temple. And now more 90s kids and and there are more marriages are seen. Even the child marriages are very common. And these even if you are attending or the responsible citizen, you can invite only close members. You can take the function in a temple or but in your home itself. That's enough. We are spending so money. Once everything is normal, you can invite them and then you can have that gathering later. And mostly we are having that a tendency that when you receive something from that social media, it is on WhatsApp or Facebook, we immediately will forward to 5 or 10 members. Nowadays, I can say that thanks to that WhatsApp management, the founder, and earlier you can forward to 100 groups, but now you can forward only 5 groups, even though the spread is very high. And no one is verifying the information, whether if you are an Indian, you have to forward, then when they want to prove that they are the Indian by forwarding the message, the fake information. And don't do that, especially related to that fear related to COVID-19, don't do that. Just verify it. And where you can do that, mostly these informations are, most of the informations are inconsistent and not reliable informations are there. You have to check the credibility of the information, where you can go to the government sources. And you may, the different, I can say that hundreds of new channels are there. Every new channel is giving the different information. They want to be unique from the other people. We people are warned about the negative news. If there is a positivity, no one will listen at it. You can see that something negative and will give importance to that. And the new channels are reporting only those informations. Stay away from the new channels for at least for this time. And where you can rely on that reliable information. Ministry of Health and Family Welfare and their website, and every day they are updating. or else in WHO, World Health Organization, everyday media briefing is there, and you can get it in your own language also. And suppose we may have the queries. I think many of you know that if there is an emergency, we will call that 108. Okay. How many of us we know that if there is an emergency or something related to the health, whom you have to contact, whether you have to pay them money, many people they may not have about it. The government of India initiated there's an helpline, national helpline numbers, toll-free numbers. And this is the one number. And another number is that in your state regional languages, that is called 104, 104. For your physical health and mental health, you can contact them. And what are the code? Is 24 into 7. 24 into 7, you can get consultation from that expert in the field, the physician and surgeon, and most of the people, psychologists, psychiatrists will be there. Even clinical psychologists are there, as per my understanding. And I visited one of the 104 center in Tamil Nadu. There I found that 5 courses for mental health, and I can see that more number of courses are for health component. The doctors are there, and they try to give the answer. And if they're receiving more number of calls, and then they will direct the calls to the doctors who volunteer for that. Understand 104 and 1075. These are the toll numbers you can contact. And when you come to know that you are having the cough and some of the symptoms which is similar to the COVID-19, don't hide it. Just say to your family members, isolate yourself and try to get a treatment for that. In the second figure, we'll talk about more. And the World Health Organization, they said that we all know that India is for good in many components, and they listed out we are the first. The most depressed country in the world is India. They listed out most depressed country, and the leading suicide is happening in India. And second one is this COVID-19 crisis. They predicted that second pandemic is on mental health issues. Mental health issues need to be addressed there. That's why they are working on it. And then probably that new commission there, psychologists also, they are counseling psychologists also, they are going to approve. Already psychiatrists, clinical psychologists, and psychiatric social workers are working on that. Psychiatric nurses also there. These field also they are come and support the initiative to promote the mental health. And distress and anxiety during this period need to be addressed in the beginning itself. When we are not, that's why when you see that most of the places when there is an accident, and the doctor will say that when you brought the patients 10 minutes before, we can able to save the life. Likewise, when we know that the particular person has that mental health issue, we brought them in the beginning itself, it is easy to solve. And most of us, we are not make it in the beginning itself. At the later stage, we come to know that the problem is bigger one, and we bring that person to that, and it is very difficult task for the clinical psychologist and psychiatrist. We have to understand when you know that. And here is the toll-free number by NIMANS. NIMANS 08046110007. This is a toll-free number. You can regional language also. You can get help from that toll-free number with any psychosocial support, any kind of psychosocial support. And if you are comfortable reading, and their manuals also uploaded in the websites, you can see that. And I think when we want to fight against COVID-19, so we have to be united, irrespective of our culture, irrespective of our religion, irrespective of our community, caste, and anything. We have to combine ourselves and we have to fight against it. And I can say that when you want to develop appropriate behavior, we have to be role model to our children, and we have to insist on the importance of having that behavior. And one note with that I can conclude my presentation. You all know that habit formation. Okay, habit formation. For example, when you look at the person, the style, I can say Rajinikanth style. Okay, South India, many of you know that. Shahrukh style. There are some style is there. Even for Narendra Modi, also having some style. So these habits will not form immediately. You cannot change the particular behavior the next day. When you want to make a change of behavior in an individual, there are some of the studies they found that 21 days you have to practice consistently. When you do that, these behaviors, when you follow by yourself and your children are observing, and these behaviors will be learned consciously as well as unconsciously. So do practice by yourself, be an ideal role model to your children. So with that note, I can conclude my presentation. Thank you, Balu sir and ma'am for giving that wonderful opportunity. And any questions, whether we can address now or shall we make it at the end of the presentation by the second speaker. Balu sir, over to you.
Yeah, thank you so much, sir. I think you have done your presentation very short.
Thank you so much, sir. Thank you so much, sir, for wonderful presentation. Thank you so much, sir.
Practice change requires which ways and there was nose and mouth. But in the COVID-19 wait till days to more behavior. Behavior to appropriate behavior. How to ensure they are practicing these appropriate behaviors? Can you suggest strategies or techniques? Dr. Suresh, or am I able to you?
Yes, sir, I can able to hear you. Shall we utter the answers right now? Shall we answer? Yes, yes, sir, I can able to hear you. Can I give the answer now, or second presenter we will give the space to her?
Yeah.
Ma'am will present, and then at the end we will take the questions. Sir.
Yeah. Okay.
I think your voice is
fine.
Okay.
Right, Dr. R. Selvi Kumari, a clinical psychologist. Am I audible, Dr. Suresh Kumar? Okay. So now I invite Dr. R. Selvi Kumari to make a presentation. She is a clinical psychologist and working with Chellamuthu Trust and also Ahana Hospital. And see, this MS Chellamuthu Trust as well as Ahana Hospital, they also working with the children's issues. So they are also close to our NIDM's heart. So in this piece, now I invite Dr. R. Selvi Kumari. The session is hand over to you, ma'am. Please let me make you as a presenter. Then you can share your screen. Yes, ma'am. The presenter role is now given to you, please. Yeah, fine, please. And yes, ma'am, your slide is visible. Please continue.
Are you able to hear me as well, sir?
Yes.
Okay. Well, at the outset, I'd like to thank the organizing team, the conveners, the patrons, as well as the coordinators of the program for having started off this very, very relevant webinar series among this COVID pandemic, jointly organized by the National Institute of Disaster Management, Government of India, as well as Vidyasagar College of Education. I'd like to thank you at the outset to have invited me to speak on a very, very relevant topic in this juncture, which is COVID appropriate behavior for children. A lot of times when we talk about the experience of COVID, I think we are largely seeing COVID as a pandemic among adults. Children, although an important and a critical part of the equation, are a lot of times the due importance of what has to be given has not been given. And I thank the organizers for bringing this to a limelight, especially when we are in the threshold of very critical decisions like whether schools and colleges have to be opened or not has to be taken, to actually ponder about the pros and cons of doing it as well. So thanks for organizing this relevant topic. And of course, I think the challenge of COVID-19, overcoming that. But at this point in time, for the next about 40 minutes, I have two challenges which is facing me. One, of course, an audience who are facing awareness program session right after their lunch, an afternoon session, you know how challenging it must be. And of course, the second challenge for me is to keep up the standards of what our very eminent speaker, Mr. Suresh Kumar, has set up with his lovely presentation as always. So let me see how best I can embrace both these challenges and move forward. So, well, let me start. I represent two pioneer organizations which has been working in the field of mental health. One is MS Chelamuthu Trust and Research Foundation, which is an NGO working in the field of serving persons with mental disabilities for more than 28 years. They cover all the services to mentally disabled under one roof, be it treatment, rehabilitation, livelihood promotion, human resource development. They have also been the National Award winner for the best institution for working towards persons with disabilities. The other organization I represent is Ahana Hospitals. It's the first NABH accredited hospital in South India for mental health care with 150-bedded neuropsychiatric hospital. And both these organizations are pioneers in child mental health as well. Now let's come to today's topic as well. Of course, COVID-19 is not a new area for any of us in the last about 7 months. So let me quickly give you an overview before we move into the details of it. So coronavirus disease, it's an infectious disease caused by an discovered coronavirus, a novel discovered coronavirus. Most people, they exhibit mild to moderate symptoms and they recover without hospitalization. Mild symptoms usually are taken care with home management, whereas serious symptoms require hospitalization. And usually it takes about an average of 5 to 6 days for symptoms to show, and it can also take up sometimes as late as 14 days. So these are some of the most common presentations of the COVID symptoms itself. You have the most common symptoms to less common symptoms to the more serious symptoms. Let's look at the stats of what it is until about 2 days back. The World Health Organization, as of November 3rd, has placed the global situation of confirmed cases of COVID at about 4,68,40,783 confirmed cases and about 12 lakh deaths so far. With India, the stats has been with 82,67,623 confirmed cases till date, with a mortality rate of 2%, meaning to say that if there are about 100 people who are infected, there is only about 2 people who are likely to result in death. Now, if you look at how does COVID spread, you know, it's usually through small germs such as viruses coming in direct contact, which usually has also a faster rate of transmission in crowded places. And of course, you know, when we don't follow the doctor's advice. So they also talk about different stages of transmission. One is getting the imported case. Stage 2 of transmission is a local transmission where the infected case coming from the outside country and spreading infection to those who come in contact with them. And then there's community transmission where if people having infection don't restrict their movement, they might spread infection to people who don't even know through infected surfaces. And of course, stage 4 is turning to an epidemic. Now, the question here is, so far we've spoken about the statistics and of course the experience about adults. The bigger question is, are children actually at risk? The answer to this question is yes, they very much are at risk, but the good news is that their risk may be lower than most of the adults. This is a statement given by Dr. Maldonado. She's a professor of pediatrics at Stanford University School of Medicine, which is pioneering research with regard to vaccinations regarding the COVID virus. She said, I can't think of another situation in which a respiratory infection only affects adults so severely. This is not common at all, and we just don't know what is going on here. The COVID experience among children and why the COVID virus has spared children is largely a mystery. And one of the very, very few hypotheses is something that I'll be presenting to you shortly. The Center for Disease Control and Prevention has also shown that children below 18 years, they are less likely to experience typical symptoms, they're less likely to die of COVID, as well as they're less likely to need hospitalization. This is definitely one good news when we look at the COVID pandemic itself. Now let's look at why what makes children more resilient, or what makes children less vulnerable to the COVID infection itself? If you look at the cause of COVID in adults, it is due to an overactive immune response to the virus in the lungs. But in case of children, fortunately, their immune system is thought as not to have been developed enough to launch such an aggressive reaction, meaning to say that their immune system is a little too premature to start reacting so strongly to the virus. So the question comes down to, all right, the good news is that fine, we don't have to worry about COVID among children, but why is there still a webinar being held for COVID appropriate behavior for children? Which means there is something there which we are missing. Why do we still need to worry if children are less vulnerable to COVID? That could be a question at the top of all our minds right now. As you see here, the impact of COVID on children is got the impact on very, very different dimensions. One, they have physical implications where you have symptoms of COVID, as well as there is, other consequences like general health issues, like lack of access to free meals, life-saving drugs, etc. There is also psychological implications in terms of it impacts a child's social, emotional, and behavioral well-being as well. As you see here, as it was mentioned earlier by Dr. Balu as well, the impact of COVID on children has not just a direct means of COVID infection, but it also has its impact on a large level of indirect impact on the entire life of a child. Let's look at some of them. It is estimated that approximately 150 million additional children will be living in multidimensional poverty without access to essential services. Before the COVID could strike, it was pinged at 47%, but after COVID, the impact is almost 56%. Up to 1.6 billion children and young people have been affected by school closures. Many do not have internet access at home. An additional of about 1.2 million children and about 56,700 mothers could die in 6 months due to disruption in basic interventions based on the worst case scenario. 370 million children may miss out on nutritious school meals. Due to COVID-19 measures, approximately 80 million children under the age of 1 in at least 68 countries may miss out on receiving life-saving vaccines. An additional of 124,000 children could be infected with HIV if prevention services are disrupted for 6 months, meaning to say that almost a decade-long progressive battle fight against HIV among children would come to a sudden halt with this COVID if this COVID restrictions continue. As we see it, it's just not merely a COVID infection to a child where the child falls sick and recovers back in hospital. As you see here, the impact of COVID is much larger than what one can imagine. Hence, it again outlines the importance of why today both NIDM and of course Vidyasagar College of Education have organized this very, very relevant webinar on appropriate COVID-related appropriate behavior among children. So how do we do it? How do we go about doing it? So as we see here, there are problems, there's impact in the physical area and there's impact in the psychological realm as well. What are the guidelines? How do we go about it? Under our able leadership of our Prime Minister, Shri Narendra Modi ji, we have launched a very, very important program as a fight against COVID, which is Jan Andolan. And again, here we have a lot of very resourceful materials in the website of Ministry of Health and Family Welfare. It is extremely useful. In fact, they have also produced a comic series, which I was surprised as to how well this can be given as an orientation for children and teachers and parents across different schools. The other thing with regard to psychological guidelines is one released by UNICEF, which again, it's a manual on psychosocial support guidelines. Both these platforms are excellent resources on guidelines of how we can counter the physical and psychological impact of COVID among children. So as I mentioned to you, Ministry of Health and Family Welfare, Government of India, they have brought about a set of 15 promises and guidelines that one can make about COVID appropriate behaviors. If we can hold up to these 15 promises, it would take us way forward in our fight against this pandemic. Well, as a surprise, there was another resource as well, as I mentioned to you earlier. This actually is a clip art. As you see here, from here on, whatever images and clip arts that you would be viewing are resources taken from the comic series, which was actually a booklet and awareness material that was released as part of the efforts of the Ministry of Health and Family Welfare for fight against corona among children. How do we educate? How do we bring about awareness about this whole pandemic among children, which is a huge challenge for even adults to understand? How do we get across this to children? So as you see here, the recently released comics, the book is called Kids, Vayu and Corona. Vayu is a character who portrays a public health worker who helps the kids to understand the concept of corona and how to fight against it. So this is a book, as you see here. It's a conversation between a son and a father. So the father says, are you talking about the book made by the environment and public health professionals of PGI and Punjab University, Chandigarh? And the son says, yes, Dad, they are bringing more comics soon on promoting health and saving the environment. Now, this is the face of the comic series I was talking to you about. There are about 2 editions. This is the first edition. It's a comic for COVID-19 awareness. This is by Dr. Ravindra Kaiwal. He is from PGI, Chandigarh. And Dr. Suman Moore, she is from Punjab University. The other part 2 is again Kids, Vayu and Corona 2. So this is more from the aspect of prevention, a comic for COVID-19 prevention strategies, again by the same authors. I must congratulate and thank the conceptors and the scriptwriters of this entire comic. Having worked with children, child mental health in this area for a very long time, I think this is an excellent resource for all of us to promote among people and platforms we know in order to promote COVID-19 awareness among children through these comics books. They even explain concepts very simple as isolation and quarantine. So the child says, we are confused, so how do we go about it? So they talk about what isolation is and what quarantine is. So even about what is home quarantine, because these are topics, these are wordings, as you see, the children will be coming across it in everyday parlance back at home when there's somebody infected with COVID. So the more uncertain, the more unknown a child is about what's happening at home, the more anxious a child will become. The more you empower them with the knowledge to understand what's happening at home, the more reassured and certain the child will become. So these could be very, very helpful ways to normalize what's happening with regard to the COVID situation itself for a child. As you see here, these are the concepts of how to stay in a well-ventilated room of home quarantine. What are the steps to be taken? Okay, so these are some of the other do's and don'ts of what is presented in the same book as to what kind of attention should be given while touching the surfaces and traveling in public transport or while using mobile phone. So as you see here, the left side, you see 3 kids, and the person in the white shirt and brown pant, he's the character called Vayu, who is a public health worker who comes as a friend to these kids to educate them on a lot of COVID-19 related doubts and questions which any child might come up with. So when the question this child asks, so the answer would be, if you're taking a cab or touching a lift button or handles of buses, immediately wash your hands with water and soap. Another question, of course, who would want to forego pizzas, burgers because of this pandemic? So the other question could be, should we eat junk food or egg or chicken? Does the virus spread by eating chicken, eggs, and meat products? No. we should avoid junk food and prefer eating healthy diet. There is no evidence that eating properly cooked meat or chicken causes this infection. The next question the child might ask is there any vaccine for this infection? The response could be no, till now there is no specific vaccine for the infection, but prevention is the only key, and we must focus on that, including government advice. Do we need to buy expensive masks or surgical masks, or will it help? So as you see here, there is no need of mask for everyone, as Bayu told earlier. If you're ill and have cough, cold, or you're going in crowded places, then a simple surgical mask is enough. When you cough or sneeze, use your elbow near the mouth. These are the steps and strategies. Mainly, we are looking at specific to children, not for adults. Let me restate that. Some of the other strategies also are, eating a healthy diet, doing yoga and meditation, and of course, drinking plenty of fluids in terms of water and juices. So another question which a child usually asks is, okay, how long can we stay inside home? We also wish to play outside. So what is the response that, now Vayu can be any of us as adults, how we could respond when a child asks these questions. Okay, so here Vayu says, kids, if possible, play inside. But you also know kids don't take no for an answer very quickly. So if you really want to go out to play, then please follow the following instructions. So as you see here, after play, always wash your hands. Cover your nose and mouth while coughing and sneezing. If you're sick, stay at home and use a face mask. You maintain respectful distance from a person who has cold, cough, or flu, and make sure that your play area is sanitized periodically. Now, so far, the slides that I presented were excerpts from the comic, which I mentioned was specially designed, was specially done as a guideline, was specially done by experts in India to handle children queries regarding COVID. Now, let's look at overall. As I mentioned earlier, there are about 15 promises to help defeat COVID-19. Okay. So in that, the first one is, of course, quite a few of this have been already covered by Mr. Suresh as well in his presentation. So let me quickly go over them. So the first one is greet without physical contact. As you say here, bye-bye to handshakes and welcome to salam namaste. So hello everyone, namaste is the way forward with regard to greeting without any sort of a physical contact. So as you see here, no hand touch, no hug, it would be more of a, hello without a physical contact. So the second promise is maintain physical distance of a minimum of about 6 feet. As you see here, don't visit friends and relatives who show flu symptoms, especially taking children also as a definite no-go. Promise number 3, wear reusable handmade face cover or mask at all times. Okay, so here the child, as it is for an adult itself, wearing mask all the time could be quite suffocating. So one question that the child might very commonly ask is, do we all need to wear mask always? Okay. So Vayu is here to answer that. He says that no, kids, you need to wear masks only when under certain specific circumstances. 1, if you have a respiratory symptom such as cough or difficulty in breathing, or if you're providing care to individuals with respiratory symptoms. Now, let's say, for example, you may have a 10-year-old or a 12-year-old child taking care of a sick grandmother or a sick parent who might be having respiratory symptoms. In that case, it's important that the child also wears masks. So there are 3 compulsory occasions when a child has to wear mask. 1 is during essential travel or going to a public place. 2nd is when in room with others in a place. And again, the 3rd one is when you have signs of cough, cold, or flu. Promise number 4, avoid touching your eyes, nose, or mouth. Why should I? Because I think more than adults, it's going to be a great challenge for, getting children not touch their eyes, nose, or mouth. It's going to be a huge challenge. But again, probably trying to explain them the reason behind it is something that might help them also to restrict or refrain from touching touching these body parts. See, hands touch many surfaces, so thereby germs get easily picked up. Thereby what happens is that these contaminated hands have the potential to transfer virus to your eyes, nose, or mouth. All these are easy channels of virus transmission into the respiratory system. So virus can enter your body and can make you sick easily. Promise number 5 is maintain a respiratory hygiene. Try to cover your nose and mouth when you cough or sneeze with either tissue or handkerchief. Not carrying a tissue or handkerchief, it's all right, no problem at all. You can cough or sneeze into your bent elbow. I think as a practice, all of us are used to sneezing like this, okay? But the actual or the right way to do it is sneezing like this at your elbow. The reason why we should not sneeze with our hands closer to the mouth is that you are directly having the droplets fall into your hands, and thereby this becomes a mode of transmission, for the virus to different places. Whereas when you do it against your elbow, the chances are that this part is likely to transmit, or this part is less likely to come in contact with other people as well. Don't forget, wash your hands immediately after you cough or sneeze. Promise number 6 is wash hands regularly and thoroughly. So you might wonder, what if we do not have sanitizers? Don't worry, washing hands with soap for 20 seconds is actually far, far better than sanitizers. And of course, in places where you can't always find a tap and a water and a soap to, wash your hands, carry a small bottle of sanitizer along with you wherever you go. So washing hands instructions, I would not go details of it because I think Mr. Suresh has very adequately covered that as well in great detail. How hand washing has to be done by children is also something given in quite detail. Promise number 7 is regularly clean and disinfect frequently touched surfaces. Okay, so the question why one might ask is, why should we avoid touching the surfaces as coronavirus can also stay there? What surfaces can we or should we avoid to touch? Okay, so there could be certain common touch points. I think all of us might be able to recognize that as well. What are the common places that we might touch again and again? So one could be surfaces such as the lift buttons, garden seats, play area swing, doorknobs at public places, bus and train handles. In fact, one of the helpful ways of opening the door is again through your elbow. They say don't use the hand to push the door, but rather try seeing if it does not have a handle, if it is something that can you just push with your elbow and push it off. So, yeah. So they also suggest that clean the floor using common household disinfectant, not just your hands, but also the floor. Promise number 8 is do not spit in the open, because spitting in the open, you put yourself as well as everyone life at direct risk. Promise number 9 is avoid unnecessary travel. Kids, if not urgent, please avoid travel to the place where coronavirus is reported. Now that's a message straight from Bayu. Okay, and here, as you see here, the children say that yes, we will also ask our parents to avoid travel if possible. And that's exactly why school buses don't ply. Promise number 10 is do not discriminate against anyone. I think media has sufficiently covered well enough during the initial stages when COVID broke out because of the increased anxiety and agitation among the public about the COVID scenario itself, how the frontline caretakers in terms of the doctors, the nurses, the police personnel were treated by the public because of fear of contracting the virus itself. What's important is show compassion and support to persons affected with COVID-19 families. reducing discrimination will actually help people to openly report themselves and seek treatment. A lot of times when stigma has scientifically been proven to predict very, very poor treatment compliance, meaning to say that now if I feel that me owning up to, yes, I have COVID is going to make me discriminated or being stigmatized by my community, I am less likely to seek treatment. When I'm less likely to seek treatment, I could be a silent spreading agent among my family, my friends, and every place that I go as well, which risks other people's lives as well as which risks my own life because I'm not taking the adequate treatment. On the other hand, when I feel accepted, when I feel supported that, yes, even if I have this infection, there are people out there ready to help me, get me treated and get better, I will openly report myself to the treating team, thereby saving myself as well as minimizing the transmission or risk of many others getting infected as well. So it boosts the morale of doctors, nurses, police, sanitation workers who are on guard 24/7 to protect us. So as already informed, show care, which is compassion, assurance, respect for these frontline workers who are 24/7 out there protecting us, as well as encouragement. I loved this quote, which I thought I must share with all of you here, which is something positive about the virus. Again, the first thing is virus is kinder to children, and the second positive thing I can look at the virus is the viruses don't discriminate, and neither should we. Okay, so as human, when a virus doesn't discriminate, why as humans should we? Is a very, very powerful statement. And I think that's something that each one of us have to ponder about. So here you see a child wearing a mask and the child is saying, I am not a virus. The child has a virus and the child is not a virus. It makes a difference where it's an important difference between discriminating when a person has a problem and the person is not the problem. Now that's the difference. Promise number 11 is discourage crowd and encourage safety. Limit going to social gatherings, say no to crowded places. I know it's very, very difficult. We all miss shopping. We all miss going to theaters. We all miss, going to functions and parties and whatnot. But as you see, this is a temporary phase that all of us will have to hold ourselves together. If we can say no to crowded places, it encourages safety among humankind as well as yourself. So keep about a 6 feet distance from others, even worst case scenario if you need to step out. For important events which cannot be postponed, keep the number of guests to minimal. Connecting virtually with loved ones is much safer. As told here, try not visiting malls, cinemas, and attend social gathering and big mass events. As you see here, avoid going in crowded places or function. And as you see here, the children are now able to realize, oh, that's why our schools are closed. Number 12 is do not circulate social media posts which carry unverified or negative information. Recent studies in COVID and mental health have proven that a lot of anxiety related to this particular pandemic stems from people always in front of the news channels wanting to hear about, as all of us know, a lot of things that's being conveyed in the news channels or on social media. If you see, actually, negativity spreads faster because that's something that earns a lot more of recognition or attention, unfortunately. So at this point in time, there is enough of negativity around us. We don't need any more of it. So us having to always focus on what's happening on TV with regard to number of deaths or number of people who are not taking help is just going to increase the anxiety levels. In fact, children being exposed to these have known to cause a lot of anxiety among children and adolescents as well. So try to keep them at bay from these exposures. And of course, one WhatsApp post will tell you, drink this, you will get immediate cure. The other WhatsApp post will say, you go here, you will get immediate solution. So try looking at verified platforms for credible information so that you don't waste your time and resources in things which are not, which don't have a basis. So as you see here, promise number 30 is seek information on COVID-19 from credible sources. The Ministry of Health and Family Welfare, Government of India, has excellent resources in fighting COVID-19, and in fact, most of my presentation slides today have excerpts from guidelines and manuals from this website only. So you will also receive updated information and facts related to all COVID-19 happening within India here. So just seek out credible sources such as this. Promise number 14 is reach out for help. There is a national toll-free helpline number, which is 1075. And of course, each of the individual states also have helpline numbers for COVID-19 related queries. Each separate union territories also have helpline numbers as well. So these are numbers that one can keep in mind if we need to reach out for help for any sort of queries. So there are two sorts of, there are two divisions I initially showed in my presentation. One is got to do with the physical impact and the other is got to do with the psychological impact. So the earlier helpline, which I mentioned to you, is largely got to do with any questions, queries with regard to COVID-19. Of course, it can involve psychosocial issues as well. But if you need specifically very context-specific psychosocial support in case of any distress or anxiety with regard to COVID, NIMHANS, which is the National Institute of Mental Health and Neurosciences, Bangalore, which is a pioneer in the whole of South Asia in mental health, they have formulated a toll-free number as a national psychosocial toll-free helpline. As you see here, that's the number right in front of you. So any issues of coping with any public emergency or outbreak, this is a number right now for you for COVID-related psychosocial support. So, so far we looked at the 15 promises that was sought as a commitment from each of us and our children to fight against COVID. These 15 promises, of course, were put forth by the Government of India, Ministry of Health and Family Welfare. Additionally, in order to widen the psychosocial support for children during COVID-19, UNICEF, which is United Nations organization specifically for the children's welfare, they have come out with a lovely manual for parents and caregivers of children during this entire COVID-19 pandemic. So what does this manual comprise of? I'm not going to go into the details of it, but I'm just going to quickly run over a broad overview of it. This resource again is freely available in the website, the UNICEF website itself, which is free for you to access. This manual covers details of understanding emotional needs of children, recognizing signs of psychological distress, helping children deal with stress, talking to children about COVID-19, which I think even our the comic book with Vayu, it was quite helpful. They have very nice worksheets or as called as toolkits. These are worksheets. It can be coloring sheets or activity sheets, which can encourage children's understanding and awareness about the COVID situation itself. These are toolkits for 6 to 10-year-old and 11 to 19-year-olds. They also specifically cover about handling children at risk for violence, abuse, and exploitation. This has got to do with what happens to children who are in orphanages, what happens to children who are in shelter homes. So how these children need to be handled as well. So the manual covers a whole lot of this area. So if you look at helping children deal with stressful events, I think they propagate three most important virtues that we need to hold in order to help a child. One, listen. You don't do the talking. Let the child do the talking. let the child talk, give the child enough opportunity to talk about what they're feeling. Now imagine the child says that, I think corona is going to come and attack us. Don't immediately jump to reassure them. No, 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 nothing is going to happen. Don't jump to reassure. First, try to understand, get them to talk about what they have imagined about this whole thing in their head. So once you have an understanding of what is there in the child's head, then respond. So the second virtue is comfort. Use simple tools of comfort and calm for children. The parent panics, the child will panic even more. So, you stay less anxious and comfort the child, which will also help the child feel more comfortable. Praise them frequently for showing courage and being helpful for people who are suffering as well during this pandemic crisis. Reassure them, saying that we are more prepared, taking these sort of precautions will help us be more courageous in fighting against the COVID situation itself. So these are some of the virtues that one can hold, or skills that one can practice in order to help children deal with stressful events. So these are some of the quick signs of psychological distress. I've put them as a separate slide. The reason being, these distress signals are signs which you need to look up to in terms of they require specialized help. So this is not something that just a parent at home can sort out, but if these are certain distress signs that you come across, it's time you take help. It's time you need to reach out. So one is difficulties in sleeping and eating. The child has nightmares. The child is suddenly withdrawn or becomes aggressive and agitated. Complaints of unexplained pain or stomach or headache without any sort of a physical reason for it. Having fears, being afraid to be left alone. Extremely clingy or nagging and dependent behaviors. Decreased interest in playing and engaging in playful activities. Being sad and crying more than usual for no apparent reasons. Audience, these are signs which should not be taken for granted, which should not be minimized or normalized. Please take help at a very initial stage before it is too late. Please remember, these children need specialized help from trained professionals. Of course, it's a very well-known fact. You have the child helpline, which is 1098. It's very easy for a child to remember as well. It's 1098. And of course, you also have the Child Welfare Committee District Child Protection Unit. So that's again from NIMHANS at this toll-free number. So these are some parenting tips, for parents itself when we look at how do you handle children during this COVID pandemic. Okay, so this again is given in detail in the guideline which I spoke to you already about in terms of the UNICEF guideline. So let me run through this with you quickly. So set aside time to spend with each child. It can be just for even 20 minutes or longer. It's up to you. It can be at the same time each day, so children or teenager can look forward to. So there's a routine that is set for the child. As to, okay, they know that Mama Papa will spend this particular time with them, so they look forward to that time. Otherwise, it becomes a sort of an uncertain. It can be any activity that you're doing together. So it can be ideas with, of course, work from home parents. It becomes a lot more challenging to allocate that time. But please see how you can commit yourself to this time with no compromise. So of course, there are certain ideas with your babies and toddlers as well. You can do things as simple as even singing songs or making music, copying their facial expressions and sounds, stacking up cups, blocks, storybook time, showing pictures. Ask your child what they would like to do. We are so eager to fill up their free time with things that we want to do. We sometimes fail to ask us what they would like to do. So ask your child what they would like to do. I understand having a teenager at home 24/7 can be a huge challenge, but it can also be a way where you get to spend some quality time, which otherwise you don't get, because a teenager is often preoccupied with, connecting with their friends, and family time is far-fetched reality, but at least lockdown has brought them face-to-face with parents for much longer than what they would have liked otherwise. So talk about something they like, go for a walk with them, do a workout together, listen to them, look at them, give them your full attention, and have fun. Lockdown can be a positive step forward in building up quality time with family as well. So certain ideas with your young child I've already spoken about. Also, I think it's important for us to have very realistic expectations. Can your child actually do what you're asking them? It is very hard for a child to keep quiet inside for a whole day, but maybe they can keep quiet for about 15 minutes. Now, let's say you're on a work call or a conference call, or you're on a meeting. You can't expect them to just keep quiet, stay still without doing anything. So see how you can get them occupied while you do this as well. Otherwise, your child is likely to feel rejected, dejected, and neglected. Listen to your child's needs. That's very, very important. Say the behaviors you want to see. In case you don't want them to make noise, don't be loud, don't shout. Instead of saying that, use more positive words. Say things like, can you please remain silent, or can you please lower your voice, can you please stay a little more quiet. So using positive words will also give a positive outlook at things with them. Praise your child when they are behaving well, because that's a very good reward system you're building up there. Make hand washing and hygiene a fun. It should not end up being a chore. You can make a song, or you can make a activity together that both of you can do in order to make hand washing a lot more fun. It can even be a game which you're doing, so that it's not a very frustrating and repeated hand chore that a person engages in. When you do it, your child will also do it. So remember, you are the first and the foremost role model for your child's behavior. Sometimes it's always important to accept that it's okay not to know the answers. Sometimes when we don't know the answers, let's not be too eager and jump to give them any wrong information, because I'm sure they will hold that up against you the next time you talk to them. So always answer questions truthfully, tell them clearly and talk clearly to them. Make time for them to listen, understand, and ask questions. If you don't know, you say, I don't know, but I'm going to come back to you with knowing what that answer is. I will definitely come back to you. So this is a very, very important, issue, which is every kid is with their tab, every kid is with their laptop, every kid is with their computers. So how do they manage to stay safe online? Okay, so number one, these are 5 golden rules to stay safe online. It is okay to block someone you're not comfortable communicating with. Number 2, do not accept friend requests from strangers. Number 3, if an email looks suspicious, it is best to delete it or mark it as junk. Number 4, passwords are not social. Do not share your password with anyone. Number 5, remember to log out while using a public computer. So these are some golden rules to stay safe online. So last but not the least, don't let what you can't do stop you from doing what you can do. When vaccine is going to come, whether vaccine is going to come, these are questions that none of us have answer to today. But each one of us, if there's one thing that we have an answer to, is that we can beat COVID if we together are able to fulfill these promises outlined by the government, outlined by health experts in overcoming this pandemic together. So with this note, I'd like to thank the organizers for giving me this opportunity to address a very, very important topic for today. Thank you very much.
Thank you so much, Dr. Selvi, for a session with practical examples and sharing a lot of valuable resources for the participants. And so in this, I request all the participants, if you're having any questions, you can raise now. The first question, one of the person was asking that, how can we get this comic Kids, Vayu and Corona? Can you share the resource link or from which website they can download it?
Sir, on behalf of Selvi Madam, I already shared the link in the WhatsApp, in the chat box.
Okay. Yeah. Thank you so much.
Thank you.
And there was one question from the participant. When can we expect the schools to reopen? The parents were looking forward. When can we expect to reopen the schools?
I can definitely tell that Dr. Suresh Kumar or Dr. Selvi are not the lawmakers or the decision makers here. We would love for children to jump back into their school buses and love to be back in school. I'm sure all of them are eager, but I think that's beyond the scope of our profession at this point in time. But we also, along with all of you, are looking forward to an answer from the government for that.
To adding with this, already the government of India has given a permission to reopen the schools, and a lot of standard operating procedures and guidelines were also given. With my personal opinion, I would like to say that the state government should give a responsibility to district authorities to decide whether to schools are to reopen or not. And at village level or at each school level, the parents teachers association meetings should be conducted, and depending on the local situation, they should take a decision to reopen the school or not. And another thing, once the vaccination is given to all, then we can 100% surely reopen the school, but we are not sure when we are going to get it. So at present, it is the responsibility of the local authorities. At the school headmaster or the district administration can decide whether the schools can be reopened in the situation or not. Thank you. There are some more questions. I think the children have too much questions about Corona. How we as a parent answer it? If also not have a proper answer. Anybody?
No,
Can I pick that question?
yes.
Yeah. In fact, this manual which I was talking to you about, UNICEF guidelines for UNICEF guidelines on psychosocial support for children, they have a separate section on what are some of the common questions that children are likely to ask when it comes to COVID, and what are some of the responses that one can give as well. Well, of course, if there are 100 questions children ask, it's not possible to find all the 100 out there. But of course, the most common ones is what is listed there. And there's also a very lovely section on how do you talk about COVID to children itself. So what are the do's, what are the don'ts? These are also things outlined in the guideline. And of course, the resource which I said with regard to the comic book on Corona itself. I think if each of us as adults can take the role of Vayu, who's also the public health worker, taking the role of Vayu will also help us, empower us to handle these sort of questions from the children. So that's one way of doing it. And of course, children don't get frustrated when children ask questions. As adults, I think when we have so many questions out there, you can imagine what should be bubbling out in their mind. Be patient, listen to them. The more you answer them, the more you make them reassured. The more reassured they are, the less anxious they will be.
Yeah, thank you, ma'am. I would like to add, when my son approaching me to answer, I'm scared I will direct him to contact his mother. Or else you can, best way you can direct him to the grandparents. So that's the one right person to give all the questions for the question. That's from my personal experience. And regarding that, there is one more question in the chat box. Any website or applications are available to the mental health of children? There are, I think you have to contact that trained professional because they are having the psychometric instrument which will help us to know that any kind of problem. But you can know that, I think in the beginning itself, Salim ma'am told that UNICEF given the guideline for psychosocial support. They given that physical, emotional, cognitive, these three components and behavior. These are the four components. You can see that the changes are there. They're given the symptoms. If you found that above 50% of the symptoms are found in your children, you can assume that the children is affected by psychological component. Then you can get, as I said, there are toll-free numbers, or else you can, I can say that grandparents are best psychologists. So I will give one example. When I'm getting angry, when I was a teen, most of my mother is an aggressive person, and when I come to my home, and my mom will say that she's the best psychologist, I can say that. She's a behavior therapist, as per my knowledge. So when I enter my home, and she will touch my head, okay, and she will hold my hands. and asked me to drink a water. Okay. I tried to forcefully say that I want to beat him because he bullied me in the public places, and that is an abusive word he used. I was very angry, and then he said, "Don't worry, relax, relax." So that words will make me to comfort. That's the best way. And when the children are disturbed physically or emotionally or socially, and we need to show that unconditional support. As we all know that Carl Rogers said the three important components: empathy, unconditional support, positive regards. So you practice these things in your home, and most of the problem you can avoid to become a bigger problem in the later stages. And there are applications are available, but I give an assurance that these applications will give reliable information. Yes, there are websites are there, and some of the websites are you have to pay the money. But I can say that government websites are available. There they given that set of questions. You can take up the questions, and if your score is more than 60%, then you can say that there's a problem need to be addressed. You can call that number given in the list. Now, would you like to add that your answer for this question? Any website or applications? It is in the
now each and everyone is familiar with these appropriate behaviors in the initiative taken for the campaign. How we ensure that our children were following the appropriate behaviors?
Sir, token economy, I think better. In behavior, we used to have, I think I'm having, you give us time, I will show that practical one. Yeah. So here is the one. This is the model we used in home. Okay, you can see my photograph and my wife and my children. There is a competition between us. Okay, when the rules were set, who is following the star will be given. At the end of the month, who is having the highest star, they will get whatever they want. So this is one of the activity token economy. We can say that rewards will make them to ensure the behaviors, better behaviors. So that is one strategy. There are many other strategies also you can adapt for ensuring that or strengthening the behavior.
Good. And sometimes this is one good strategy which you have shared. I think it will be very much useful for all the parents to adapt to ensure their children's appropriate behavior. And I found that the children have habit of often used to touch their mouth, nose, and eyes. Okay, more than adult, they used to often touch it. And when people have thought of that when we are saying don't do, and we are more enthusiastic to do that, especially children. Saying that don't touch your eyes, don't touch it. In that situation, how can we convince your child?
I think it's a difficult question to answer, most sensitive also. Yes, I will try my level best. I think there are certain behavior you may aware about thumb sucking. Okay. So even though when you say that no one is watching, the children will used to suck the thumbs. What they will do that, I can say that my grandmother, what she will do is use neem oil or aloe vera. She will paste it, she will take and then put it in my fingers. Whenever I put it in my mouth and I feel bitter, I will not do that again. So these kind of things you can ensure that. Or if we give the punishment, the elderly young one, it's nothing wrong in it. That is the only way to cut immediate effect you can find out. Cognitive, it is not working. The behavioral therapy is on best for children. That's my understanding, I think. Maybe ma'am give input for that. Ma'am, what you?
Yeah, thank you, Dr. Suresh.
Tell you, ma'am.
Well, well, I think it's a very challenging question to answer. First, I think we'll have to be quite realistic with our expectations. I mean, that's what I, mentioned in my presentation as well. If we are going to expect that a child must not touch their eyes, nose, and mouth, which is the most frequently touched body parts of any person, leave it alone children, it's quite unrealistic. So that way, let us be quite realistic in our expectation of what we can expect of a child as well. One. The second thing is that I think when we practice a lot of the other, not touching your eyes, nose, and mouth is one part of the guideline. But if you actually follow the other parts of it, now let's say, for example, cleaning the surfaces frequently, or let's say using hand sanitizer, using hand washing, when these things are happening, they somewhere compensate for the frequency with which you're going to be touching your body parts as well. So that way, it's not just following one strategy, but it's about following a combination of strategies which increases the safety, quotient of what you are actually fighting against. So that would be the practical way of doing it. And of course, staying indoors is also a way of, not posing yourself at risk and stepping out only when it is absolutely essential. I do understand supervision or monitoring from parents becomes an added responsibility when it comes to much younger children of younger age groups. So that way, I think, some sort of a monitoring of the child also is something might be required for younger children as well.
Yeah. Thank you, Dr. Selvi and Suresh Kumar, for a wonderful answer. Dr. Savitra, would you like to speak anything? Do you have any points to add here?
Savita ma'am, please unmute your mic.
Yeah, thank you, Sidvi ma'am. So first of all, I would like to thank Suresh sir and Sidvi ma'am for such a wonderful presentation. And both have given very practical solutions or suggestions for appropriate behavior. Because nowadays schools are going to open. I think in most of the states, schools are already open and they are maintaining this social distancing and other government protocols. And even in the colleges, admissions are going on. So crowd are there in schools and colleges and other institutions during exams. You know that recently NEET exams and IIT exams and other exams are going on. So it is very necessary to know each and everyone, even that most important for teachers and parents. So they should follow the government rules and they should teach and they should suggest some government protocols to their children when they go out from the home for appearing for these exams or for admissions or for schools and colleges. Because you know that the government has already declared that maybe in the month of December that regular classes started in most of the institutions. So this is the very important to know each and every parents, teachers, and that they would because actually they know everything. We don't expect from children that they should do themselves. But we, as a parent, as a teacher, as a member of society, community, we can suggest, we can teach our children to maintain the appropriate behavior against COVID-19, against fight COVID-19. And today, that presentation of both Suresh sir and Sidvi ma'am, I really appreciate that such a wonderful presentation. I am astonished to see your side and your research on this topic. And really, I thank to Dr. Balu sir to organize such a nice speaker to this webinar. Thank you, Balu sir, for inviting such a nice speaker. And I am very glad to hear from you. And I such a nice platform to be connected to you both. And hope that in future also we will do lots of this communication and this type of webinar. Thank you so much. And participants, yes, and last but not the least, I'm very thankful to participants for their patient hearing, and they are asking very real questions and practical questions. So thank you so much, participants. Yes, Balu sir.
Yeah, thank you, Dr. Savitra. So to conclude this webinar, just I'd like to conclude with few points. As we are aware that maintaining a social distancing, wearing masks, and frequently washing our hands and maintaining hygienic respiratory practices, these are the 4 important things which we need to ensure our children practice to prevent from infection of COVID-19. Right? So it's our responsibility to take care of our children as well. And when they are going outside or they are in travel or going to school or when they are going for a shopping event. So as per this Government of India's guideline, this Unlock 5 we need to avoid stepping of the children from out of the home. So unless if it is very essential, then please take away your child. Otherwise, please ensure that better child can be inside your home to prevent from this infection of COVID-19. That will be helpful for everyone as well as for the. So I would like to first of all thank our Major General Manoj Kumar Bindal sir, Executive Director NIDM, and Professor Santosh Kumar sir, CCDRR Professor and Head, and Dr. Kumar Raka, who is a Program Officer, and also the convener of this program, Dr. Savitra Misra, Principal, Vidyasagar College of Education, and Kipika Adhikari, the Coordinator, Vidyasagar College of Education, and the honorable speakers, Dr. Suresh Kumar Murugesan and Dr. R. Selvi Kumari, for made a wonderful presentation on this occasion. So I also once again extend my sincere gratitude to both the speaker as well as the participants who made this program as very successful. Thank you so much to everyone. Thank you. So the attendance link will be shared now in the chat box. The participants who have participated, you can register yourself. You can register your attendance. Dr. Savita, ma'am, let us meet up.
Yeah, thank you, sir. Thank you so much, sir. Thank you so much, sir.
Ma'am, thank you, ma'am. Thank you, sir. We'll meet again.
Dr. Suresh Kumar, are you now? I would like to make a call up to you.
Sir, can I take leave? Yeah. Balu sir, can I take leave? Sorry, I didn't hear you.
Please, you can take a leave. Thank you so much for being with us.
Thanks a lot, Dr. Balu. Thank you so much.
Your contribution in future also.
Definitely, I'll be happy to. Thank you so much. Best wishes. Bye.
Thank you.